Hello, and thank you so much for joining us. Whether you're watching on TV or online, I'm Anthony Robart. We're waiting for the latest update from the Prime Minister. In about 15 minutes, he will walk out of his home at Rideau Cottage in Ottawa after taking a couple of days to spend Easter with his family at the PM's other residence, their cottage at Lake Harrington in Quebec. Now, Mr. Trudeau facing some questions about that. We'll explore that a little bit further later on. In the meantime, let's have some developing news on the economy. And the International Monetary Fund has released dramatic new predictions. It says the world economy will likely suffer its worst year since the Great Depression. Pretty stark here. The IMF forecasting that the global economy will shrink 3% this year before rebounding next year with 5.8% growth. However, damage could be even worse if COVID-19 persists longer than expected. As for Canada, the IMF is predicting the Canadian economy will shrink 6.2% this year, followed by a growth of 4.2% in 2021. So as we track those economic numbers, we also continue, of course, to monitor the latest numbers of COVID-19 infections in Canada and around the world. Let's begin with the big picture. And globally, there are now almost 2 million confirmed cases of coronavirus, with close to 600,000 of those in the United States, where there have now been more than 23,000 deaths linked to COVID-19. Closer to home in Canada, more than 25,000 people have tested positive for the virus. Now, as we take a closer look, the majority of cases remain in the eastern provinces. Quebec now reporting more than 13,500 cases. In Ontario, that province is fast approaching the 8,000 mark. Further west, Alberta now reporting more than 1,700 infections, and British Columbia now has close to 1,500 confirmed cases. Across Canada, almost 800 people have died. Now, the pandemic has had a devastating impact on long-term care homes specifically. Nearly half of the country's death toll can be traced back to these facilities.
A significant proportion of these deaths are linked to outbreaks in long-term care facilities. Sadly, because COVID-19 can have a prolonged course, these deaths will continue to increase even as the epidemic growth rate slows down.
In Quebec, one care home in Dorval is now the subject of a criminal investigation as well as a coroner's inquest. 31 deaths have been reported at this facility. Now, this prompted the inspection of every private nursing home in the province. Quebec Premier François Legault says protecting the elderly is the top priority.
In the vast majority of CHSLDs and residences, people are cared for by dedicated staff. And where the situation is critical, we're sending people.
Meantime, Ontario's long-term care homes have also been hard hit. This is the Pinecrest Nursing Home in Bobcaygeon. It has lost close to half of its residents. And a West Toronto care home says 25 residents have died from COVID-19. All right, let's check in with our chief political correspondent, David Akin, who joins us from his home in Ottawa. David, thank you so much for joining us. Lots to get to, of course. Let's begin with a new fund to help Canadian farmers bringing in temporary foreign workers. How will that work?
Yeah, this is a big deal because it is planting time for a lot of fruit and vegetable growers primarily. This temporary foreign workers come into the country also to work in some of our meat processing plants. And we do know that right now some meat processing plants are down because of COVID-19 striking some meat workers, and that threatens our supply chain. So just to give you a sense of the situation here, in the spring of last year, the first 3 months of last year, we saw 24,000 temporary foreign workers come to work just in the agriculture sector alone. And they're a vital source of experienced labor. And I don't think that can be stressed enough. A lot of these folks who come up from Mexico, Guatemala, places in Central America are coming again and again, year after year, to the same farms, the same facilities. They've been trained to work on those facilities. It does take some skill, and right now farmers and processors need those folks here. But of course we got COVID-19. So a couple of things. There's some new health regimens for temporary foreign workers. First of all, they're going to be assessed in their home country by a health official, and that health official has to be certified by Health Canada. So that's the first step in their home country. Then in their home country, in their own language, they're going to get a thorough briefing on what they can expect once they get to Canada, to our quarantine situation, our quarantine protocol. They'll be given a mask in their home country and told, you've got to wear that mask on the entire flight and until you get to your isolation headquarters. So that's the health regimen. Here's what employers have to do, and it's quite a significant thing. First of all, employers have to place all their temporary foreign workers into a 14-day quarantine. That's at the employer's expense. It can't be in a bunkhouse down at the end of the farm. It has to be in a safe environment for self-isolation. That's likely a hotel room, and again, that's at the employer's expense. Two, the employer's got to make sure that food is provided to all these temporary foreign workers in isolation because they can't leave anywhere for 14 days. And third, the employer has to pay the wages that these individuals would normally make during those 2 weeks. To help with that, the federal government is saying farmers and food processors can take advantage of a fund, it's $50 million right now, but could get bigger if it needs to be, that will pay employers $1,500 per temporary foreign worker. $1,500 per temporary foreign worker. We talked to some agricultural producers yesterday. This will help with some, but it won't pay all the bills. As I said, there's quite a few obligations on the employer. The federal government warning that any employer or employee that violates any of these rules is going to face strict sanctions. There are some questions I should point out, Anthony, the opposition here in Ottawa, pointing out why aren't we just testing every single foreign worker as they arrive at the border rather than quarantine them? Test them right away. The issue there is, according to the Agriculture Minister, Marie-Claude Bibeau, resources. We just don't have the testing resources. Right. So the federal government is following the advice of public health officials to do this particular quarantine effect. If we were to test foreign workers at the border, we'd likely be taking tests away from long-term retirement home workers, retirement home residents. Right now, it's a balancing resources kind of issue. But that's what's happening for temporary foreign workers right now, to get them in the country to do the job that they normally do to get Canada's food supply, keep it running. This is the time to start planting a lot of fruits and vegetables.
All right, David, lots to get to, of course. We appreciate you giving a little more insight on this. It gets a little complicated for a lot of people, but obviously this money will help, at least in the short term, for some people. David, we'll have to leave it there for now, but we'll get back to you in a little bit. Let's remind everyone, if you're just joining us, we're waiting for the Prime Minister to address the nation. He took a couple of days off to spend Easter with his family. That will get going in about 13 minutes, give or take. We'll bring that to you live the moment it happens. Let's stay in Ottawa and bring in Abigail Beeman. Abigail, we got into some of the numbers getting into this, and we showed that about half of all the coronavirus deaths in this country have been connected to long-term care facilities. The government, the federal government, has released some guidelines. The question is, what does that mean in terms of implementing them? Because these are recommendations, are they not? How exactly will that work?
Well, that's a very important point, and that's one of the first things that critics are pointing to, who say that we need immediate change, immediate action after we hear heartbreaking story after heartbreaking story of what's happening in homes right across the country. The federal government did release a pretty comprehensive list of recommendations, but like you say, they are recommendations. Some of the big ones: that staff should not work in more than one facility, that everybody should be wearing masks, that visitors should be restricted. All of these things are efforts that, you know, experts applaud, but say need to happen, not just be recommendations. When we heard the Chief Medical Officer of Health, Dr. Theresa Tam, yesterday give that startling statistic about half of deaths happening in long-term care facilities, it was really stark because she juxtaposed that with talking about how actually there was some positive news. On the whole, case numbers seem to be slowing in the day-to-day increase. That seems to be slowing down, which is positive news. But at the same time, she said she expects the number of deaths to increase in long-term care facilities. That's something that the government is watching very closely. closely. But in terms of action that the government's taking, well, when the seniors minister was asked, hey, is there going to be any financial help for this? What is the federal government doing? And of course, important to note that healthcare falls under provincial jurisdiction. The seniors minister, her answer was to point to a few provinces that have promised hundreds of millions of dollars or tens of millions of dollars to help in those specific cases. But there seems to be no word about any funding from the feds. Again, it comes down to these recommendations they released over the weekend, which are at this point just recommendations.
Okay, I want to ask you about testing rates, and obviously there's a disparity across the country, just as there is a disparity in the number of infections. Where are we on that? Some provinces doing a lot better than others. Any movement on that? Any improvement, at least?
That's right. I think we really need to talk about Alberta. Alberta is leading the way in terms of testing numbers. And yesterday, they came out and said that now anyone with symptoms will be eligible for a test. Sounds pretty simple, but that's certainly not happening right across the country. There are numerous restrictions right across the country on who's eligible for a test. A lot have to do with, did you just travel or are you in close contact with somebody who traveled? And as we watch the ratio and the numbers of community infections rather than travel-based infections, that community infection number is increasing. So a lot of people are anxious to have that test, but we hear all the time about people with symptoms who aren't eligible for testing. So Alberta seems to be leading the way. Newfoundland seems pretty close in terms of who is eligible to get a test. Ontario is really lagging behind, and we've heard about this for quite some time in terms of the testing numbers. They are really low at the bottom of the list here in terms of how many people they are testing. But a lot of questions around, how do we have an accurate picture of the numbers here if there are people with symptoms who are being turned away from being tested, not to mention asymptomatic people who may be infected, may not know it, and there's still a lot of questions around that.
Yeah, there's so many unknowns, and that will obviously try to get answered in the coming days. And one of the things that we need to, at least will help, is the rapid testing kit. And this is a made-in-Canada approach. I mean, you got to know what you're fighting before you fight it. And that will certainly help. What do we know about that, and where is this going to go to? What are some of the prioritized regions it's heading to?
That's right. So you're talking about the test kits from Spartan Bioscience, which is a company based right here in Ottawa. Canadian made, everything from the swabs to that cube that you're seeing, which is the DNA analyzer. The big benefit to this test kit is that it's portable. They describe it as about the size of a coffee cup. So it doesn't need a lab, and you don't need a lab technician to administer this test. So it can be used anywhere from, airports to doctors' offices. So the priority here, according to the government, which has ordered more than 1 million and which were green lighted by Health Canada now this weekend, is to get them to more remote areas that don't have a connection to a lab or a centralized testing zone. So you'll see them heading to those more remote communities that need those tests done.
Abigail, thank you so much for this. We'll touch base in a little bit. And if you're just joining us at home, we're waiting for the Prime Minister to speak to the nation. That's in really just a few minutes, but that could come at any point, and we'll bring that to you live the moment it happens. In the meantime, let's head to Quebec City, where Raquel Fletcher is standing by, and we're focusing on long-term care homes. Raquel, a devastating situation across the country, particularly in Quebec, specifically at one location in the Montreal area. Talk about the measures that have been implemented in response to this. Now, in some case, a criminal investigation. Talk about that.
Yeah, there are actually 3 investigations being launched right now. The Ministry of Health, of course, police have been investigating since the long weekend, and the coroner is also doing his own investigation to get to the bottom of this. We're learning a little bit more about what happened. Of course, more questions than answers at this point, but obviously the Heron residence, as you mentioned, in Dorval, has raised a lot of alarm bells. 31 deaths in less than a month. Families still wanting to know, what happened to their loved ones. The owners came out yesterday and spoke for the first time to media, pointing the finger at the CIRS, that's the French acronym for the health center, the health region that takes care of that particular region. The owners say that they flagged issues to that health center and they didn't receive the help that they needed. So what we're finding out here is, some of the employees who were in contact with the residents who had COVID-19, they were self-isolating at home for 14 days, meaning that there weren't enough employees to take care of all of the residents. About 150 beds in that particular residence. So there was a lot of pressure put on the employees who were left, and they just couldn't take care of everyone. The other problem that happened, obviously, is visits were banned. Family members, many of them act as caregivers. They come in, they take care of their loved ones, and they provide relief for the paid employees. Well, they weren't allowed to come in anymore. So a lot of questions, a lot of criticism pointed towards that particular government policy. Did that make matters worse in the end? And, the government is saying, well, it's a fine balance. They were trying to, prevent the spread of COVID-19, and that it was up to the owners to say, the Premier came out, Premier François Legault, yesterday saying, it's one thing to say to the health region, we're missing employees. It's another thing to say, hey, this is a crisis, this is an emergency. We have 31 people who passed away. They should have done more to flag that. But of course, that's all under investigation, and that will come out within the next weeks or months what happened. So that's where we stand right now. So a lot of questions again to be answered.
A lot of families looking for answers. Raquel, thank you so much. We are going to join the Prime Minister as he brings his address. Let's listen in there.
Lab techs and hospital staff are hard at work to keep us safe. They're showing up for us, and we need to do the same for them. Over the weekend, we received new shipments of essential personal protective equipment, including 4 planes worth of N95 masks. As we speak, workers are unpacking and validating these supplies so we can start shipping them to the provinces and territories as quickly as possible. These new N95 masks are in addition to the more than 820,000 that went to provinces last week. All told, this means that we have 1.1 million N95s ready to be shipped to the provinces and territories, with more to come. We have also received millions of pairs of gloves, and we'll be getting new protective gowns delivered from domestic suppliers starting next Monday. En fin de semaine, on a reçu 4 envois d'équipements de protection.
Over the weekend, 4 planes worth of personal protective equipment arrived, including N95 masks. There was also an order for Quebec. These new N95 masks are added to the over 820,000 masks received last week. We are preparing to send 1.1 million N95 masks to the provinces and territories over the next few days. We've also received millions of pairs of gloves, and we will receive new protective gowns as of next Monday. As for the tests, we are now making huge progress. I'm thinking of Spotted Bioscience based in Ottawa that will provide tens of thousands of test kits per month. As Dr. Tam was saying yesterday, over 430,000 tests have been done in Canada. We will continue to increase our testing capacity and to find new technology to simplify testing throughout the country.
In the last few days, we've also made progress on testing. Right now, we're moving forward on a range of rapid testing kits, both from here in Canada and internationally. This includes Ottawa-based Spartan Bioscience, who will soon be supplying tens of thousands of kits per month and potentially more as production increases. As Dr. Tam said yesterday, more than 430,000 Canadians have now been tested for COVID-19. Our experts and health professionals are working hard to increase our capacity to keep ramping up tests across the country. Demand for these supplies is going up, and we're going to make sure Canada can keep up.
COVID-19 has changed people's daily lives, but those who are living in the Arctic regions don't have the same issues as those who are living in cities. For example, I know that many are concerned to see empty grocery store shelves, and others don't know if their healthcare center has enough space and enough resources to fight against the virus if it sets into their community. We are doing everything we can to avoid this. Today, I'm announcing that the government will invest close to $130 million to assist northern communities in their fight against COVID-19. From this sum, $72.6 million will be sent to the Yukon, to the Northwest Territories, and Nunavut for their healthcare system needs and to fight against COVID-19. We are also allocating funds to Nutrition North Canada so that food and essential goods remain affordable and to help families to stay healthy, and so that food and medical equipment can be brought there. We are working with air carriers who will bring essential products to the north. Finally, I know that many businesses in the north have been hard hit by this crisis. We are going to provide help to business owners whose expenses are not already covered by the other measures that have been implemented.
We're investing almost $130 million to support northern communities in dealing with COVID-19. If you live in the north, chances are you're worried about whether your local health centre has the resources to fight COVID-19 and to cope with cases that might come up. So we're providing $72.6 million to the Yukon, the Northwest Territories, and Nunavut, specifically for healthcare and community preparedness. We're also investing more money to Nutrition North Canada. This will make it easier to afford the food and basics that keep you and your family healthy. And to ensure that things like groceries and medical equipment can continue to get to you, we're providing funding for northern air carriers to transport these supplies. These are tough times, but we're going to help you through them, to set your community up to come back strong when things get better. Because they will. We have to think about small businesses, too. I know entrepreneurs in the north have been hit especially hard by this crisis. If you own a business and your costs aren't already covered by other measures we've put in place, we're giving Cannor more funding to help. No matter where you live, in a small community or a big city, we're here for you. This weekend, we brought Parliament back to pass the largest economic policy since the Second World War. With the Canadian Emergency Wage Subsidy, we will protect jobs by helping businesses keep their employees on the payroll. We'll be rolling this measure out as quickly as possible. And now, as many people as we've already helped, and we're talking about millions of Canadians, we know there is more to do. You might not currently qualify for the Canada Emergency Response Benefit, but you still might need a hand. If you're a student or an essential worker, for example, this week we'll be talking about how to reach you while also supporting sectors that have been especially hard hit. At the same time, we're working to enhance the Canada Emergency Business Account, as well as new supports on commercial rent for businesses that are hardest hit. I'll have more to say about all this soon. If you've come back to Canada from abroad, as of today, we are strengthening measures. Now, if asymptomatic travelers cannot explain a credible quarantine plan, they will be required to quarantine in a hotel. This will come into effect at midnight tonight. We are also announcing $20 million for the Canadian Food Inspection Agency to strengthen food inspections and keep our food supply safe. This will mean we can build capacity for more overtime and extra shifts for inspectors to fill demand. It also means we can invest in things like hiring and training to get more people on board. On vit des moments difficiles. Et à travers le pays, je sais que
We're going through a hard time, and I know that many people are concerned not only for their future and their health, but for that of their grandparents. The elderly are especially vulnerable faced with COVID-19. That means that we should not go visit them in long-term care homes, in healthcare institutions. To protect them, we have published new guidelines for this type of establishment. We have set out clear rules on restricting visits, on measures of control for staff, and what to do in case of infection. At the same time, we continue to work with the provinces and territories to ensure that they have everything they require to make sure that people stay healthy.
I want to take a moment to speak directly to everyone who's lost a loved one. If you're grieving, know that you're not alone. We are here for you, even through this incredibly tough time. And you remind us why it's so important to do everything we can to keep one another safe. We all need to do our part. We can't let up now. So to everyone, stay at home. And no matter what, stay 2 meters apart if you do have to go out. When it gets hard, let's remember that we're all in this together. Merci beaucoup. Et maintenant, prendre les questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Kate Bolongaro, Bloomberg. Line open.
Hello, Mr. Prime Minister. I'm wondering, what is your government's concrete plan to reopen the economy? For example, a rolling, staggered, or an all-at-once approach? And can you give us more information about these plans and your discussions with the provinces on reopening the economy?
I know that everyone is very interested to know when things are going to get back to normal, when they'll be able to go back to work, when we'll be able to leave this isolation at home, when kids will be able to go back to schools. The reality is it is going to be weeks still. We recognize that it is going to be important to get our economy going and that we will have to do it in phases. We will have to remain vigilant until such a point as a vaccine against COVID-19 is found. We are having ongoing discussions with the provinces at this point. We recognize that different regions of the country are at different places along the evolution of their COVID-19 curve. We're going to make sure that we try to stay coordinated as best as possible, but those discussions are ongoing about how we're going to reopen the economy. It's just that it's going to be a while still.
And you had just mentioned sectors.
Sorry, Kate, I just let me answer in French. Évidemment, les gens veulent savoir.
People want to know when we will be able to go back to normal life, when people can go, when they can go back to work, when children will go back to school. The reality is that we have to be extremely vigilant. We have to continue for several weeks still. But at some point, I hope we will be able to begin easing up on some measures. We'll do that in coordination with the provinces. We recognize that different regions of the country are going through impacts that are different. They are not at the same place on the COVID-19 infection curve, and we will be vigilant up until the time that we have a vaccine. These conversations are ongoing, but it's not for right now.
Just mentioned about sectors who have been especially hard hit by COVID-19 and that we should be expecting news on help for them soon. And I'm wondering specifically, when is the oil industry bailout coming?
First of all, we recognize that the most important thing from the very beginning was to get help out to Canadians right across the country, regardless of the sectors they're in, regardless of their situation or their location. That's why we put forward two extremely strong measures that help all workers across the country: the Canada Emergency Response Benefit for people who've lost a paycheck, and the emergency wage subsidy so that people can keep their jobs and be ready to come back to work when the economy comes back. As I've said a number of times, we will and we are looking at more specific sector-related relief and supports for those sectors that are hardest hit, whether it's the tourism sector, the airline sector, or the oil and gas industry or others, and we will have more to say on that shortly.
Thank you. Next question.
Thank you. Merci. La prochaine question, Raymond Fillon, TVA, à vous.
Bonjour, Monsieur le Premier Ministre.
Hello, Mr. Prime Minister. Now, with regards to the seniors' homes, I know that this is provincial jurisdiction. Other than guidelines, what can your government do before a situation as what we see in many seniors' homes in the long-term care home Heron in the Montreal region, for example? These stories are horrifying, and we send all our condolences to families that are affected by the high death rate in our long-term care homes for seniors. And this is why we would like to highlight the extent to which people need to follow instructions. People need to stay home and continue with social distancing to stop the spread of COVID-19. As you're saying, the long-term care homes are a provincial jurisdiction. We have set out guidelines, and we will continue to work with the provinces to do everything that we can to assist them so that our seniors stay safe. We recognize that they are the most vulnerable to COVID-19, and this is why we all, at all levels of government and all Canadians, we have to do everything in our power to protect them.
Recognize the terrible and tragic stories that have come out of seniors' residences and long-term care facilities across this country. And our hearts go out to families who've lost loved ones in some terrible ways. We know we need to do more, and that is why we are highlighting how important it is, not just for ourselves, but for our loved ones, for our healthcare workers, for our seniors, that we continue to follow directions, that we stay home as much as possible, that we keep 2 meters apart wherever we can, and that we continue to wash our hands regularly. We need to make sure that our seniors who are most vulnerable to this are protected. As mentioned, seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Suivi.
Un des gros problèmes dans ces centres, c'est le manque criant d'emplois.
One of the worst problems is the lack of staff. Could we put the armed forces? Could we use them to help out? There are measures that are being taken by the provinces, for example, to force people to work only in one long-term care home and not several. This will help to protect the elderly. But this will also create the need to hire people, the need to find extra workers for these centers in order to help out the seniors. We are working with the provinces. We are trying to make sure that we have the capacity and the ability to have the necessary staff to help the seniors.
Some of the measures taken in place to protect our seniors in our long-term care facilities, such as asking people to only work in one centre instead of a few of them, will mean a need to hire more people to support our seniors and to work in those centres. And we're going to continue to work with provinces on ways to ensure that people can be found to do this important work.
Thank you. Prochaine question, modérateur.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. I would like to come back to your stay at Harrington Lake. For several weeks now, the authorities have been telling us not to go to our cottage, and in Outaouais there are checkpoints on the bridges so that people don't cross from Ottawa to Gatineau. So I'm wondering why, in the case of your own family, it was okay for you to go there. I announced this last week. I said that after 3 weeks of working here, my family, who is living in at Harrington Lake, that I would go spend Easter with my family, and we continue to respect all the guidelines.
Mentioned last week in my presentation, after 3 weeks of my family living up at Harrington and me working here, I went to join them for Easter. We continue to follow all the instructions from public health authorities.
Merci. Question de suivi, Hélène.
Mais oui, avez-vous eu une indication comme quoi?
Yes, but did people tell you that this was okay? All over social media, people are wondering why this exception was okay for you. Why it was okay for you to go see your family at the cottage. My family has been living there for 3 weeks. This is where my wife and my children live. And as I announced last week, I was going to go spend Easter with them there.
Merci. Next question, Alex Bellengal, Toronto Star. Line is open.
Morning, Prime Minister. You mentioned in your introduction that people traveling to Canada will need a credible quarantine plan. Can you expand on what the government's definition of a credible plan will be? Who will assess that, and where will that be applied at the land border as well as at airports?
The order that goes in tonight is a strengthening of the Quarantine Act orders to give authorities the ability, upon evaluation of the person entering Canada's plan to self-quarantine. If it is inadequate, they will be required to quarantine in a hotel. Examples of things that could be inadequate, for example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination if they've been outside of the country for many years. We now have the authority to require them to self-isolate for 2 weeks in a quarantine location like a hotel.
On follow-up?
Okay. Yeah, I noticed in the daily updates from public health, there's been incomplete information sort of stubbornly over a period of time, with case report forms on only 62% of our cases, hospitalization data for less than half. Why is this such an incomplete picture, and are you concerned that having an incomplete picture will affect or make it more difficult to allocate resources across the country?
I want to once again thank the provinces for being tremendously active on improving the quality of the data that they send us in Ottawa. There were significant gaps in the beginning, but I can highlight that almost all provinces have done a much better job in sharing their data with Canadians in their provinces, but also with the federal government, that is allowing us to have a much more complete picture. We continue to improve on data collection and collation every single day, but that is something that, as you highlight, is a really important way to ensure that we're doing the right things at the right point to keep Canadians safe.
Prime Minister Michael Couture with Global National. I wanted to ask you, Alberta's energy minister has said that she's expecting a federal relief package for Canada's oil and gas sector between $20 and $30 billion, and she's expecting it later this week. Can you confirm those details first, and can you say if the federal government will be taking equity stakes in Canadian firms?
When we have issues to announce on sectoral supports, we will be making those announcements.
So then, as a follow-up, some workers in the oil patch worry that key Canadian companies will be vulnerable to foreign takeovers or will decide to relocate head offices to other jurisdictions. Should your government forbid foreign takeovers in the energy sector or relocations for at least this period of time?
We are very concerned about the state of a number of industries across this country, including the oil and gas industry, and that's why we have worked hard on making sure that we're giving the right supports for the industry, and particularly for workers across the country. Our focus has always been on ensuring that good Canadian jobs remain. We know that Canadians and families are suffering, and that's why we need to support them. We recognize
that it's very important to protect our industries so that we can recover financially after this crisis, but we need to support the workers and the families that are hard hit by COVID-19.
Oliver with CTV National News. You said that you're going to have more news about essential workers and the CERB in the coming week, but employees at long-term care facilities are already leaving their jobs. You brought Parliament back and you passed the wage subsidy this weekend, but there was no specific help included for the long-term care industry. What specifically is your government going to do now to keep long-term care facilities properly staffed so that the new guidelines your government implemented this weekend can be followed?
We are in conversation with the provinces right now on on moving forward on a model of increasing support for long-term care workers and other workers in essential industries, like Quebec has done, to ensure that people are motivated and encouraged financially, as well as because it's something that they believe in deeply, to continue caring for our most vulnerable.
We recognize that Quebec has implemented concrete measures to encourage and also to pay people who are working in long-term care homes. These people play an essential role right now. We are having discussions with the provinces to do this on a national level.
Canada's intelligence network was not prepared for the pandemic, and that instead of being able to rely on our own Canadian intelligence, we were dependent on our American allies as well as the Five Eyes network. When specifically and exactly did Canadian intelligence tell you about the possibility of a pandemic, and when did you hear that information from our allies?
We had meetings of the incident response group as of late January to talk about the COVID-19 potential threat. We were well coordinated with our Five Eyes allies and other intelligence services around the world, and being aware of this potential challenge on the horizon, and we're dealing with it as of the end of January. Nous avions eu des rencontres au niveau de
We had meetings with regards to security and intelligence at the end of January. We highlighted our concerns and that we had with regards to coronavirus at the time. And this is something that we continue to follow up in concert with our allies from the Five Eyes Network and other allies around the world. Chrystia Noël, Radio-Canada. Earlier, you spoke about a phased recovery for the economy. What could this look like for people and their daily lives? What would this staggered recovery look like, and on the border as well? I understand that people want to know when we will be able to go back to economic activity. We need to stay in this phase for quite a while still. We're not yet on the other side of the curve during this first wave of COVID-19. We have to hang on up until experts and science tell us that we can begin easing up on some measures. There will be some industries and some sectors where people will be able to go back to work in a more safe fashion. And we will have these discussions with the provinces. We will discuss this with the provinces in the weeks to come. Now, with regards to the U.S., we continue to discuss with the Americans, and we talk about a coordinated approach. The travel restrictions will last for many weeks to come.
People are eager to know when we'll get into the next phase and be able to loosen some of the restrictions on work, on school. We will be looking at that very carefully with the provinces in different ways across the country to make sure that where we start work up again in the weeks where we're allowed to do that, because right now we are still very much in this phase and will need to remain in this phase for a good while still. But as we start to open up, we will be strategic and vigilant about what we are able to do in a very gradual way. In regards to the American border, we recognize that travel restrictions are going to remain extremely important in terms of containing the spread of COVID-19 in Canada, and we're going to continue to work with the Americans and people around the world to ensure that we continue with these restrictions.
Now, with regards to long-term care homes, you say that you're having discussions with the province to see how you can help them. What are the provinces asking for? Money, staff, medical staff from the Army? What is part of the discussion, and what can the federal government do more concretely to help them? We have different conversations with the provinces with regards to the long-term care homes throughout the country, because the regions are very different. Their situation is very different. Some provinces are very interested by the Quebec model, which seeks to provide extra pay to those who are working in the seniors' homes. And some provinces are interested, and the federal government might be able to participate and send additional funding to help these people out. There are other proposals coming from different provinces, and we're looking at everything. We're trying to see to what extent it's important. It's important to be there for seniors, and there hasn't been any requests made for the help by the Canadian Army.
Ways of ensuring that our long-term care facilities and our seniors' residences have the support that they actually need, have the workforce that they need to take care of our seniors. There are a number of provinces looking at the model put forward by Quebec that involves a salary top-up for people working in these essential jobs. We are willing to participate in that, in sending money to the provinces to help in those, and we're having discussions with the provinces about what that is. But there are very different needs and situations right across the country, and we're continuing to work with different provinces on their different priorities.
Prime Minister Tom Perry with the CBC News. Premier Jason Kenney says that federal bureaucracy is standing in the way of approving tests and drugs to use against COVID-19. He's directed his officials to consider using medications that have been approved by Europe or the U.S. Health officials. Health Canada is the regulator of these approvals here in Canada, so what would the consequence of a province attempting to do this be, given it doesn't have that jurisdiction?
We are in an unprecedented crisis, and that creates a significant level of anxiety. So I understand that people can get anxious and impatient about things, but as a government, we are going to remain grounded in science. We are going to remain grounded in our experts who are doing an excellent job in ensuring that Canadians are kept safe and healthy. Okay.
I recognize that we are in an unprecedented situation, and people can become impatient and feel quite anxious. We are going to stay the course. We're going to follow the recommendations made by the experts and public health officials to keep Canadians safe and healthy.
Yesterday about Dr. Chrystia Tam, and he said he believes she's qualified to be Canada's Chief Public Health Officer, but he also said that in January she was repeating talking points out of the People's Republic of China about there being no evidence of human-to-human transmission. What's your response to that? And do you think comments like this run the risk of undermining the credibility of Canada's public health officials?
I think Canadians have demonstrated that they have a tremendous level of trust and confidence in our public health officials and in our medical system. And we are going to continue to work with top medical officials like Dr. Chrystia Tam to make sure that we're doing everything we need to do and have done every step of the way to keep Canadians safe. Les Canadiens ont raison d'avoir confiance.
Canadians can trust our public health officials, our medical specialists. They are there to help us and to protect us. We will continue to work with all the public health experts to ensure the health and safety of all Canadians, including, of course, the wonderful Dr. Tam. Thank you. That's all for the press conference. Thank you.
And that wraps up our address from the Prime Minister. Let's stay in Ottawa and bring in Abigail Beeman. Abigail, I don't know if you're there right now, but of course he mentioned many things, some news coming out of that, and some reference to the Quarantine Act. And recently, the RCMP was asked to enforce the Quarantine Act, go door to door if necessary. The fine could be pretty steep, $750,000. Talk about the new measures that will be put in place in a matter of hours.
Right. So the Prime Minister announcing as of midnight tonight, any traveler returning to Canada who doesn't have, I believe he used the word a credible self-isolation plan will be forced to quarantine in a hotel. Worth pointing out, this was a move made by British Columbia last week. The feds now seems to be picking up on what they thought was a good idea. So in BC, when this rolled out last week, they had people at the airport checking with people who had to fill out a form as to where they're going to self-isolate, how it's going to work. And so assuming if the federal program rolls out the same way, if somebody does not give a valid enough answer about what their plan is for the next 2 weeks, once they enter the country, they will be forced to go to a hotel to quarantine there.
That would, in many ways, indicate that people have not necessarily adhered to adhere to the rules and the law. Also, he was talking about the money, significant sum of money, in fact, going to Canada's north. Looking at the numbers out of Yukon, Northwest Territories, and Nunavut, 8 in Yukon, 5 cases in Northwest Territories, 0 cases in Nunavut. So about $130 million allotted to the north. How will that break down? Do we know?
Yes, we do have some idea of the breakdown. There will be help for airlines that fly into the north, exclusively help to get food and essential goods up there. You know all the challenges involved in getting goods to the north, highly challenging money there, as well as money for businesses in the north that can't get help by all of the other means that the government has announced. So funding for food, essential goods, airlines, business. While we were listening to the Prime Minister, his office confirmed to me that all of that money is new money announced today, because we just keep hearing about money and economic stimulus all the time. But they're telling me that of this $130 million, everything except the $15 million earmarked specifically for business is new money announced today with help for the north. And you mentioned the number of cases up there, but I think it's important for Canadians to remember, just as an example of how isolated it is and what the concerns are. I was told that in Nunavut, when I was researching how many ventilators are on hand, how many ICU beds there are, I was told that in Nunavut, they actually only have 8 transport ventilators. If somebody gets COVID-19 or they're sick in Nunavut, they need to be transported out of there with a temporary transport ventilator to get them help in the south. So it's really a dire situation. If the situation were to get worse in terms of number of cases, there's not the capacity or the healthcare system to help. And that's why that money will be badly needed in those areas.
All right, Abigail, thank you so much. A lot to uncover there, but we really appreciate all of your insight on that. Let's bring in our chief political correspondent, David Akin, now joining us from the nation's capital. And David, the Prime Minister was asked about more help, and he referred to more help is on the way to the other sectors. I suppose that is a reference to, and he was asked about this in follow-up questions, the oil and gas sector, decimated by this. Do we have any sense of how that would or could work?
Well, we've been trying to get answers from both the federal government as well as some provincial governments active in the federal oil and gas sector, governments of Alberta, Saskatchewan, Newfoundland, and Labrador. Their provincial revenues depend heavily on royalties from the oil and gas sector, and Newfoundland and Labrador is in particularly big trouble right now. What we do know is that yesterday, the Alberta Energy Minister, Sonia Savage, she said that she was expecting a, quote, liquidity bailout of somewhere between $20 and $30 billion that the provincial and federal governments will be working on. And I want to be clear here, what we mean by a liquidity bailout is essentially a bona fide corporate bailout. This would not be money that is going to help workers in any way. The Prime Minister's response today is quite accurate. The wage subsidy available to all employers, including the oil and gas sector, that can be used to help workers. The CERB, that can be used to help laid off workers. But my sources in the Alberta government, they are worried about the fact that some of the major Canadian oil and gas players could be are at risk of takeovers from foreign firms, particularly Chinese firms who've long had an interest in the Canadian oil patch. They're worried that Canadian firms will up and move to other jurisdictions. We saw some Canadian energy players move to Houston, for example. That's the big fear from Alberta, and that's what the federal government is being asked to do, to basically provide capital to corporations. You can see the political problem here. It's an industry that polarizes a lot of people in the country. The Green parties of the world, some liberals, certainly do Democrats, do not want money to be bailing out corporations, a la 2008 and 2009, when the federal government took a stake in some car companies, notably General Motors. So that's what we're talking about. The PM today saying something on this oil and gas sector relief is coming, quote, in the coming days, but he's been saying that now for 2 or 3 weeks, he and his other cabinet ministers. Notably also, things come in the coming days is rent for small business, commercial rent relief for small businesses. The Prime Minister not providing any details, but saying we're going to talk about about that in the coming days, and also talking in the, quote, coming days, it's his favorite phrase today, about trying to fill in the gaps for those who do not qualify for the Canada Emergency Response Benefit, the CERB. I've heard from a lot of viewers who, for instance, applied for and started employment insurance in January or February. In some parts of the country, you only get 16 weeks or more on EI. What happens when the EI benefits run out? Right now, under the CERB guidelines, you're not allowed to qualify for CERB. So the Prime Minister is saying today he's going to address those sorts of gaps. It was one of the key things for NDP leader Jagmeet Singh when we had that parliamentary session on the weekend. Singh and the NDP absolutely stressed that we've got to fill those gaps in coverage for the CERB. So not many substantial details about what is happening now, just to promise that in the coming days, we're going to talk about this.
But as you mentioned, people have been waiting now weeks for some answers. And this is every day, of course, the problems keep mounting. He also mentioned the shipment of 1.1 million masks. And this sort of goes into the bigger issue of preparedness. He was asked about this as well, because obviously the equipment, the supplies, personal equipment necessary, vital across the country, and that will be shipped across the country into the respective provinces in the coming days. He was asked about the preparedness, and that's a question that will keep coming up, won't it? Why wasn't this government, all governments really, more prepared given what was happening around the world, in China, in Iran, in Italy?
Well, if we don't see something along the lines of a royal commission or a major parliamentary inquiry, once this is all done, I'd be shocked, because there are a lot of questions that we're seeing in the government's own documents. Just a couple of weeks ago, the House of Commons Standing Committee on Health met, and they literally got thousands of pages of government documents put before them, and reporters are slowly going through those documents. So, for example, one of the things that the opposition's been most concerned about is the fact that Canada sent 16 tons of medical supplies to China in early February, when China was going through the worst of its crisis, and people going, what were you thinking sending away supplies that were needed? Well, those documents, as reporters are going through them, there are expiry dates on a lot of this medical equipment. And this was part of our national stockpile that literally was going to expire, and we'd have had to throw it out, or we could have sent it to China. And of course, we've seen China now sending a lot of supplies to Canada. I think this Canada-China supply line is something that is really going to beg a lot of study. China's coming under increasing scrutiny from all sorts of angles about what it didn't tell the World Health Organization about the crisis in its own country. When did it tell people? So there's a lot of accountability questions about China. On the other hand, right now Canada is really relying on Chinese factories to produce N95 masks, to produce ventilators, and that's, as you mentioned, that's what's coming into Canada and now has to be checked. So this is a very odd relationship right now between Canada and China. It was, of course, cold as all get out because of the arrests of the two Michaels, Michael Spavor, Michael Kovrig, the arrest in Canada of the Huawei executive. But now Canada relying heavily on China. Anthony, as I said, this is a story that we are going to be pursuing, I think, for months once this COVID crisis begins to wind up.
And how do you see the Made in Canada response? We've seen a lot of efforts in the mobilization of Canadian industry over the past few weeks. The Spartan Bioscience, one of the most notable recently. How much, and this kind of connects to the dependence on China and where we are going to go and try to become a little more insular, a little more isolationist, I guess, when it comes to that side of it. What's your perspective?
I don't know if isolationist might be the right word. I see what you're getting at. I think independent absolutely is the right word. And I think it's been tremendously heartening to see Canadian businesses pitch in, all hands on deck. We do know that more than 5,000 Canadian businesses put their hand up and said, I can help make something. I can do masks, or I can do gowns. We saw a car manufacturer in North Toronto that is normally used to making airbags. Well, airbags, maybe if they're a little thinner, they could be hospital gowns, and that's exactly what's happening. We're looking for ventilator production in Canada. Apparently, we're going to see 40,000 ventilators made in Canada, where just a month ago, 0 ventilators are made in Canada. We know that there's a pulp mill in Nanaimo, BC, that uses a found in Canada only kind of fiber in Western red cedar that's vital for the manufacture of hospital gowns, hospital drapes, some hospital masks. So we're learning all these things about our industrial capacity, and to as I say, the great credit of Canadian industrial leaders, factories, industrial organizations, restrictions. They are turning everything towards being as independent as we can be in terms of making the personal protective gear that our frontline healthcare workers need. And I think that too is one of the encouraging stories that we ought to take a look at, as we do the look back on how Canada was prepared for this crisis and handled this crisis.
Now, David, we don't have a lot of time, but real quick, Easter weekend, going back a little bit in terms of the rules, we've all been told, stay at home, don't go to the rural areas, if you have a cottage, don't do that. What do you make of the Prime Minister's response in that? And keep in mind, he's not the only one, because Andrew Scheer, the opposition leader, facing some questions about his flight over the weekend with his family, not exactly respecting the physical distancing rules. Thoughts?
So cut me off if I get going on too long with this one, because I do have some thoughts, but I'll be quick. First, all the email I'm getting these days is from people worried about their EI, oil and gas workers working about their job. Where the PM, Andrew Scheer, etc. went over the Easter weekend, I think is a lower priority. But there's a lot of judgment issues to go around here. The real question for the PM is, why was his family living at Harrington Lake in the first place? He's standing in front of Rideau Cottage. It's not a cottage, it's a mansion. That's where his family lives, and why they aren't living in their home in Ottawa where the PM is working, I think that's the broader question. Why did you send your family away? For Andrew Scheer, yes, he's an essential worker. He's the leader of the opposition. He should take a government jet to travel to Ottawa, but why did his family have to accompany him? Lots of Canadians are having to be separated from their families during this time. It doesn't make sense to me. I think it's a judgment call on Mr. Scheer that he said he's bringing his 5 family members. They could have stayed in their home in Regina. And let's not forget who else was on that plane, crammed together, as some people say. It was Elizabeth May, the late 60s Green Party MP. What was her essential travel? There was 40 MPs in the House of Commons. It got passed unanimously. Maybe some questions for
David, we're up against the clock. We really appreciate this. We have to wrap up there, but of course, always a big thank you. Lots more to come on this story throughout the day on globalnews.ca and Global National. For everyone here, I'm Anthony Robart. Thank you so much for watching.
Et merci de vous être rejoint à nous aujourd'hui.
Thank you for tuning in today.
Comme le Premier ministre a annoncé ce matin,
the Prime Minister made an announcement today.
Le gouvernement du Canada
As
met
of tonight,
à jour l'ordonnance d'urgence
the government
sur
of
la
Canada
loi sur la
is
mise en
amending
quarantaine
the Federal
qui exige
Quarantine
que
Act.
toutes les personnes entrant au Canada,
All
que ce soit
those who
pour voie
arrive in
aérienne,
Canada
terrestre
by
ou
land,
maritime,
sea, or
doivent
air
s'isoler pendant 14
will have
jours.
to self-isolate
Avec
for
la mise
14
à jour de
days.
l'ordonnance, tout
This
voyageur arrivant
update
au
to the
Canada,
federal
qu'il
quarantine
soit
orders
symptomatique
will make
ou
it such that all
asymptomatique,
those who
est
arrive in Canada,
interdit de
whether
s'isoler
or not
dans
they
un
have
endroit où ils
symptoms,
seraient en
will have
contact
to
avec des personnes
isolate
vulnérables,
somewhere
tels que
where
des
they will
adultes de
not
65 ans
be endangering
ou des personnes
vulnerable
de
people
tous âgés
such
ayant
as
des problèmes
seniors
médicaux préexistants.
or all
À
people
leur
with
arrivée, les
pre-existing
voyageurs doivent
underlying medical
également
conditions.
confirmer qu'ils ont un endroit approprié pour s'isoler
Travelers
où ils
will
auront
have to
accès aux
demonstrate that they
besoins
have an
essentiels
appropriate
tels que de la
self-isolation
nourriture
plan
et des
where they will
médicaments
have access
et
to
où
food
ils n'auront
and
pas de
medication.
contact avec des personnes vulnérables. Les
They will
voyageurs
they will have
arrivant
to
au
demonstrate
Canada
that they will not
doivent
be
prévoir
near
à
vulnerable
l'avance
people.
l'endroit où ils seront
People
isolés
traveling to Canada
ou
will
mis
have
en
to
quarantaine.
plan their
Tout
quarantine
voyageur qui
location
ne dispose
ahead
pas
of
du
time.
lieu adéquat pour s'isoler
And all
ou
those
se mettre en
who do not
quarantaine
have an
doit se
appropriate
rendre à un
self-isolation
endroit
or quarantine
désigné
plan
par
will
l'administrateur en
have to
chef de la santé
self-isolate
publique
in
du
a
Canada.
location
Il peut
selected by the
s'agir, par
Chief Public
exemple,
Health Officer
d'un
of
hôtel.
Canada.
Ces nouvelles mesures obligatoires
This could be, for
constituent
instance,
une
a
couche
hotel.
supplémentaire dans les actions du Canada
This
visant
is
à
an additional
protéger la
step
santé
that Canada
des
is
Canadiens
taking to
et
protect
Canadiennes.
the health of all
As the
Canadians.
Prime Minister announced this morning, as of tonight at midnight, the Government of Canada is updating the emergency order under the Quarantine Act that requires all persons entering Canada, whether by land, air, or sea, to isolate or quarantine for 14 days. With the updated order, any traveler arriving in Canada, whether they are symptomatic or asymptomatic, is forbidden to isolate in a place where they would be in contact with people who are vulnerable, such as adults of 65 years of age or older, and people of all ages with pre-existing medical conditions. Upon arrival, travelers will also need to confirm that they have a suitable place to isolate, where they will have access to basic necessities, such as food and medicine, and will not come into contact with vulnerable people. Travelers arriving into Canada need to make plans in advance for where they will isolate or quarantine. Any traveler who does not have an adequate place in which to isolate or quarantine themselves must go to a place designated by the Chief Public Health Officer of Canada. This includes, for example, a hotel. These mandatory new measures are an additional layer in Canada's actions to protect the health of all Canadians. This follows conversations with many provinces and the new measures we announced together with British Columbia last week. The measures, which include a new legal requirement to provide a self-isolation plan, support provincial health officers' travel orders, and reinforce the federal emergency order under the Quarantine Act, requiring people entering Canada to self-isolate for 14 days. And now, today, we will hear from Canada's Chief Public Health Officer, Dr. Chrystia Tam, our Deputy Chief Public Health Officer, le Dr. Howard New, by video link, the Minister of Northern Affairs, Dan Van Daal, et le Président du Conseil du Trésor, Jean-Yves Duclos.
We will also hear from the President of the Treasury Board, Jean-Yves Duclos.
And, of course, with us is our Minister of Health, Patty Hajdu, available to answer your questions. So, Dr. Tam, please.
Bonjour, and I'll start with our usual update on the number of COVID-19 cases in Canada. So there are now 26,631 cases, including 823 deaths. These results, of course, change over the day. For the lab testing, we've completed tests for over 450,000 people, with now close to 6% confirmed positive, as Canada continues to improve our testing to track where the disease is spreading. These times have been challenging for all of us, but they can be especially hard for children. Children's daily routines have been turned upside down, and the things that they have most been looking forward to have been cancelled. As for us, it is for them. Silence and secrets do not protect children. Honesty and openness do. There are things we can do to help build resilience, like talking to kids honestly and reassuring them that we will get through this. Open discussion helps kids to sort fact from fiction, to look for ways to have some control, and to be mindful of their media consumption. We can also show children how to express gratitude for the efforts of everyone who is helping us through this time, like healthcare workers on the front line and all the people working to keep our essential supplies open and grocery stores stocked. At the same time, it's a lesson in all the many roles that people play all across Canada to keep our society running. Over the weekend, I was reminded that this April marks the 40th anniversary of Terry Fox's Marathon of Hope. Terry believed that anything is possible if you try, and that even one person can make a difference. Although Terry was not able to complete his journey, his spirit of hope remains with Canadians all these years later. Right now, we need to heed his message more than ever. The sacrifices we are making to maintain physical distancing are making a difference to slow the spread of COVID-19. So stay home, save lives, and let's give our best efforts to plank the curve. Then crush it. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New. Dr. New.
Over to you,
Merci.
Dr. New.
Bonjour. On commence tout d'abord par faire le point sur le nombre de cas de COVID-19 au Canada.
With our usual update on the number of COVID-19 cases in Canada.
631 cas
There are
de
now
COVID-19 au pays,
26,631 cases of COVID-19 in Canada, including 823 deaths. These results change daily and throughout the day. As for lab testing, we've completed tests for over 450,000 people, with now close to 6% confirmed positive. Canada continues to improve testing to better track where the disease is spreading. These times have been challenging for all of us, but can be especially hard for children. Children's daily routines have been turned upside down, and the things that they've been most looking forward to have been cancelled. Children are the same as us in that silence and secrets do not protect them. Honesty and openness do. When we talk to children honestly and when we reassure them that we will get through this, we can help them build their resilience. Open discussions help kids to sort fact from fiction. Open discussion helps kids look for ways of having control and to be mindful of their media consumption. We can also show our children how to express gratitude for the efforts of everyone who is helping us through this time, like healthcare workers on the front lines and all the people who are working hard to keep our essential stores open and stocked. At the same time, this is a lesson in the many roles that people play in Canadian society to keep our society running. April 2020 marks the 40th anniversary of Terry Fox's Marathon of Hope. Terry believed that anything is possible if you try, and that even one person can make a big difference. Although Terry was not able to complete his Marathon of Hope, his spirit of hope remains with Canadians. 40 years later, right now, we need to heed Terry's message, which is more important today than ever before. The sacrifices that we are making now to maintain physical distancing are making a real difference in slowing the spread of COVID-19. So let's stay home, let's save lives, and let's give it our all to plank this curve as soon as possible. Thank you.
Merci, Dr. No. And
Thank
now
you, Dr.
we will
Neal.
hear by video link from Winnipeg from our Minister of Northern Affairs, Dan Vandal. Dan, please.
Oui, bonjour, good morning.
Hello.
Since the COVID-19 crisis started, I have been in constant communication with territorial premiers as well as First Nation, Inuit, and Métis nations and partners across the North. Their concerns, their ideas, and solutions have been informing our response to COVID-19 in the North since day one. We recognize that many Canadians are facing financial hardship, and they are concerned for their health, their jobs, their loved ones, and their neighborhoods. This is especially true in Canada's North. There are exceptional challenges in meeting the unique needs of Northerners in this pandemic. Le mois dernier, nous avons annoncé un financement de
Last month,
305
we
millions de
announced
dollars
$305
pour
million
aider les
in
communautés et les
funds to support
organisations
Indigenous
autochtones à
communities
travers
and
le Canada
organizations
à
across
répondre aux
Canada
besoins
to
immédiats
address immediate
liés
needs
au
related to
COVID-19.
COVID-19.
Ce financement s'ajoute
This
au soutien
is in
fondé
addition to
sur les
needs-based
besoins en
support
santé et de gestion
for
des
First
urgences
Nations
des
and
Premières Nations
Inuit Health
et des Inuits et vient appuyer les autres mesures financières
and
qui sont maintenant
complements
à
other
la
financial
disposition de tous
supports
les
that are
Canadiens,
now available
incluant
to all
les Premières
Canadians,
Nations, les Métis et
including
les
First
Inuits.
Nations, Inuit, and Métis.
Territorial governments have identified their critical priorities to prepare for and to respond to the COVID-19 pandemic and to avoid the spread of the virus. Today, we are announcing significant next steps to address concerns facing the North, including support for healthcare, for nutrition, and for air transport. The Government of Canada is transferring $89.9 million to the territorial governments to assist with health preparation and response and to support continuity of air transportation services to northern communities. The majority of this funding is primarily for territorial healthcare systems, including critical healthcare needs preparedness and mitigation efforts. And as we know, airlines are a critical link to maintaining the supply chain for the movement of essential goods and services. In order to do this, the Government of Canada is providing $17.3 million in immediate relief to support critical air transportation links on key essential routes in Nunavut, the Northwest Territories, and Yukon. Le financement d'aujourd'hui s'appuie sur les 500 millions de dollars qui ont déjà été
Today's
annoncés
funding
le
builds on
11
the
mars
$500
pour les
million
besoins essentiels des
of
systèmes de soins de
funding
santé
announced on March
provinciaux et
11th.
territoriaux
The
et pour
$500
soutenir
million
les efforts
is
d'atténuation
for
qui
provincial and
tiennent compte de
territorial
l'augmentation
critical
des
health
coûts
care system
et des
needs
circonstances
and to
particulières
support
auxquelles
mitigation
sont
efforts that
confrontés les
recognize
gouvernements
the increased
territoriaux.
costs and special circumstances
We also
facing territorial
recognize the increased
governments.
cost of many essential goods in the North. Families are facing increased financial pressures and should not be worried about how to pay for nutritious food or essential household supplies. That is why we are investing an additional $25 million to Nutrition North Canada to better support Northern families in accessing sufficient, safe, nutritious food by increasing the subsidy rate on basic and essential goods that families depend on. We have also added cleaning and personal hygiene products to the list of eligible items of Nutrition North Canada to all Northern communities. I'm also very pleased that funding for the first year of the Harvesters Support Grant has been allocated to Indigenous nations and partners, and we are working diligently to flow the next wave of money quickly. This grant, co-developed with Indigenous partners, helps Northerners return to traditional harvesting and food sharing practices by alleviating the high costs associated with traditional hunting and harvesting of foods. As you know, this crisis is evolving very rapidly, and we recognize that we will continue to support the health, safety, and the well-being of Northerners. We will continue to collaborate with territorial, provincial, and Indigenous and other partners to determine future responses as part of our ongoing efforts to fight COVID-19. By ensuring we maintain our physical distancing, by staying home, and by connecting remotely as I am today, we can plank the curve and get through this together. Thank you, merci, and miigwech.
Okay, thank you very much, Dan. Et maintenant, je donne la parole au président du Conseil du Trésor,
We will now hear from the President of the Treasury Board,
Merci, Chrystia. Hello, everyone. Bonjour tout le monde.
Chrystia.
Le message du
Hello,
Premier
everyone.
ministre ce matin, c'est un message de protection.
The Prime Minister
Protection
spoke
tout
today
d'abord
about
de ceux et celles qui nous
protection,
protègent aussi dans
about
les soins de santé.
protecting those
Donc un
who work in
message
healthcare and
de
are protecting
collaboration
us.
entre les provinces et les territoires pour
The Prime Minister
l'approvisionnement, mais aussi
spoke
la
of the
distribution de
importance
matériel
of
de
collaboration
protection,
of
de
working
tests
with the
et de
provinces,
traitements tellement importants pour nos
especially in
travailleurs
distributing
en
and
milieu
sharing
médical. Le deuxième
PPE
message de
and tests
protection,
that are
c'est
so
celui que
important
le
for
ministre
those
Vandal vient
working
de
in
nous
the healthcare
résumer,
system.
c'est-à-dire de
Another
protéger les
layer
gens
of
qui habitent
protection
dans les territoires
was
en
just
milieu
presented to
nordique
us
et
by
qui font
Minister
face à des
Vandal, and
défis
that
substantiels en
is to
matière
protect
économique,
those living
de
in
santé,
Canada's
de
north,
services
and they
sociaux,
face
mais aussi en
substantial
matière
hardship
de
in
transport
social
et
services,
d'alimentation. Le troisième
transportation,
message de protection,
and getting
c'est
critical
celui
supplies
pour
such as
nos
food
aînés
and
qui vivent dans des
medication.
résidences et dans des
We must
milieux
also
de soins de
protect
longue
our
durée qui
seniors
vivent
living in long-term
difficilement,
care
mais qui ont
facilities,
besoin
living in
et qui profitent
residences.
de l'appui de tous ces travailleurs de première ligne qui sont là pour les aider.
Frontline
Donc le
workers
partage de
working
lignes
in these centers
directrices
and
avec les
facilities
provinces et les
help them
territoires
and
et
protect them.
ces échanges importants et fructueux
And we are
qui ont
working
lieu
with
entre le
provinces and
gouvernement canadien
territories.
et
We
les
are
provinces
constantly
pour
in
aider
talks with
à
provinces and
rémunérer et
territories
appuyer
to better
solidement les
remunerate
travailleurs dans
workers
ces milieux
who help
importants.
our
Et le
seniors.
dernier message de protection,
And
c'est celui de
one final
protéger
message
à
and
la
layer
fois la
of
capacité
protection.
de joindre les deux bouts, mais aussi la capacité de prendre soin de sa
We need
santé
to
et de la
connect,
santé
protect
de ses
Canadians
proches.
financially.
Et
Canadians
là-dessus,
need to be
bien,
able
les
to make
nouvelles de la
ends meet,
prestation
to
canadienne
stay
aux
healthy,
urgences
and to
sont,
keep others
sont
healthy.
importantes. Au cours de la dernière
That's
semaine, le
why
gouvernement
the
canadien a
Canada
reçu
Emergency Response
3,5
Benefit
millions
is so
de
important.
demandes de prestations canadiennes
Last
d'urgence.
week,
Depuis le
we
15 mars,
received
c'est un total de 6
3.5
millions
million
de demandes qui ont
applications
été
for the
reçues
CERB, and in
et un
fact, since
total
March
de
15th, we have
5,4 millions
received
de
6
demandes
million
ont déjà été
applications
traitées.
for
So
the CERB,
briefly in English,
5.5 million of
Canada
which have
Emergency
already
Response
been
Benefit,
processed.
protecting the ability of Canadians to make ends meet and to look after their health and the health of their loved ones is in part done by the provision of the Canada Emergency Response Benefit. So a total of 3.5 million applications have been posted in the last week, a total of 6 million since March the 15th, and out of these 6 million applications, 5.4 million have already been treated. So that's for me, Chrystia.
Okay. Merci Jean-Yves. Et on est prêt à répondre
Thank you,
à vos questions.
Jean-Yves. And we are now ready
Thank
to
you,
take
Deputy Prime Minister.
questions.
As usual, we'll start with 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Une question, un suivi. Opératrice?
Operator, over
Thank
to
you.
you.
Merci. Please press star 1 at this time if you have a question. N'hésitez pas à appuyer sur étoile 1. Our first question is from Lena Bibb, La Presse canadienne. Please go ahead. La parole est à vous.
Question, Lena Dib, La Presse Canadienne. I have a question about the new announcement about the federal quarantine orders. Why is it necessary to take this step now? I thought that when the act was originally announced, quarantine would necessarily be mandatory for everyone arriving in Canada. So have you been noticing, for example, non-compliance that makes this additional step necessary? Answer. Thank you for the question. You are absolutely right that self-isolation and quarantine for incoming travelers have been mandatory right since the outset. But we are taking additional steps. This new measure will give governments more tools in their toolbox to enforce quarantine.
Dr. New, oui. On a déjà l'ordre obligatoire selon la loi sur la mise en quarantaine.
Dr.
Mais
New
aussi
speaking.
avec le nouvel ordre, on a mieux précisé parce que
The
les autres
federal
conditions,
orders
c'est important
under
pour,
the Quarantine
pour
Act
les
are
voyageurs qui arrivent au
already
Canada d'avoir un
in
plan
force.
pour vraiment préciser.
But we are
Ils
taking
vont
this additional
pas,
step because those who
aller dans
arrive
une
to
accommodation
Canada
avec
must
les
have
autres
an
personnes
adequate
vulnérables,
plan.
avec
We
des
don't want
conditions
incoming
médicales sous-jacentes
travelers
ou une
going
personne âgée plus de
to
65 ans.
self-isolate
Ça,
with
c'est
seniors
important.
over the age of
Aussi, c'est
65
important de
or
préciser
with those who
qu'avec
have
le plan, il faut aussi
pre-existing underlying medical
indiquer
conditions.
qu'ils vont être dans une place où on a aussi
Those
accès
who
aux
arrive in Canada will
des
have
choses
to
importantes,
provide a detailed
comme la
plan. They
nourriture,
will have
aussi
to
des
demonstrate
médicaments.
that they will
Et aussi,
have
on a même les
access
petits
to
détails.
essential
On va aussi
supplies such as
fournir
food
même
and
une masque pour
medication.
les voyageurs.
And to
Même
give you a
ils
bit
sont
more information,
asymptomatiques
we
pour
will
voyager
be
alors
giving
qu'on a des
masks to all
destinations finales.
incoming travelers,
C'est vraiment une question
whether
de
they have symptoms
donner
or
plus
not.
de détails pour préciser qu'est-ce qui est
So we are
exigé.
taking this additional step in order to clarify and enforce what is mandatory. Follow-up question.
Our next question is from Mike Blanchfield from the Canadian Press. Please go ahead. La parole est à vous.
Good morning, everybody, or good afternoon. I'm directing this question at the Deputy Prime Minister, but perhaps others will want to answer. The Leader of the Opposition this morning was raising questions about the World Health Organization. He said he has concerns about the reliability of their data, their relationship with China, and we've seen new reporting raising some questions related to this in recent days. So how much faith should Canadians have in the World Health Organization right now, and are there areas where the government should be exercising some caution or evaluating, taking a second look at what they're being told by the WHO?
Thanks for the question, Mike. When it comes to medical expertise and health expertise, the first people we rely on are Canada's outstanding public health professionals, our great team here in Ottawa, and the public health professionals across the country. And we are very lucky in Canada to have an excellent healthcare system and very, very smart public health professionals. When it comes to international cooperation, I think we all appreciate that the novel coronavirus is a global pandemic, and that does require international collaboration, multilateral collaboration. The WHO is the international body that coordinates international response to pandemics. And so, of course, we work actively with the WHO. We also collaborate closely with other allies in other fora. Our Minister of Health has regularly been meeting with, including just last week, the G7 health ministers, for example. That's an important forum for us. And so is partnership with our allies around the world. Now, I don't know, Patty, if you would like to add anything?
Well, I'll just say a couple words. Yes, I think it's important to realize that I think that the WHO is not a standalone organization without multiple sources of research feeding into it. And when I think about the expert committee that Dr. Tam sits on, in fact, those committee meetings are extremely important for the world to coordinate its response to coronavirus. And I think that the Deputy Prime Minister is exactly right, that when we look at illness and disease in a global setting. In fact, we cannot defeat this virus or any virus or illness without our global partners, and we've seen that multiple times with a variety of different illnesses. So I think we have these structures internationally, and they play a really important role, and it is about the coordination of response. And I think, Dr. Tam, would you like to say a few words about the kinds of things that are discussed at the special committee that might help highlight what the kind of thinking how the thinking has evolved, for example, as the research has?
I think the WHO does consist of all of its member states, so of which Canada is one, but it taps into the global community of scientists, researchers, epidemiologists. So I think it has multiple committees, and some of them looks at research and development, some of them will look at the surveillance and trying to keep the world appraised of the latest evolution in the virus, for example. So there are multitudes and many layers of sort of expert committees, and that is one of the key roles. For sure, nobody sort of can anticipate the sort of evolution in knowledge, of course, of this virus. So we knew very little at the beginning. People try to accelerate and get the information as fast as they can. I think as we progress, absolutely the whole world has to be able to provide epidemic control of this virus for Canada and the rest of the world to look at what the new normal might look like, because we are dependent on other countries also being able to control their illness. So I think now more than ever, international collaboration is actually very key.
Mike?
My follow-up question is, and I understand perhaps you may not want to be seen to be sowing doubt in a major international organization at this time. Be that as it may, Dr. Allward was supposed to testify this afternoon at the Health Committee and give an insight into the WHO. Now the official opposition is saying, well, that's unfortunate, that shouldn't have happened. And they want to know more about how Canada is engaging with the WHO in light of criticisms that continue to keep surfacing about whether or not one of those partners, China, has been living up to its obligations, perhaps, or not, in relation to its work with the WHO. So could someone please address that concern that the WHO, that is raised by the leader of the opposition very clearly this morning in a press conference?
Well, I'll just add to what we've already said about the role of the WHO and its importance in terms of understanding sort of global pandemics and the trajectory of illness around the world and how we work together to manage that. But I will say, in terms of the Health Committee, we have been regular participants at the Health Committee, and of course, as I've mentioned, Dr. Tam is an expert advisor to the committee at World Health Organization that's been leading the response on coronavirus. And we've been available to the Health Committee at every request, and in fact spent numerous hours just a couple weeks ago, I think, Dr. Tam and Dr. New and my deputy answering the questions of the Health Committee, and we'll continue to do that. This is, I believe, this is a time where we do need to pull together, not just internationally, but also nationally. This is an actual health crisis for Canada, and we work very hard to make sure that the opposition has an ability to ask those questions and has the information at their fingertips when they ask for it.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question is from Micheline Laflamme de Radio-Canada. Please go ahead. La parole est à vous.
Micheline Laflamme, Radio-Canada. Question.
Pour l'opportunité.
Hello.
Dites-moi, alors, quels sont, que vous demandent en ce moment les provinces pour les aider à faire face à la crise?
What provinces are asking of you? What support are provinces asking for as concerns retirement homes and long-term care facilities? And what type of help could the federal government provide
Thank you for the question. We can offer different types of supports. Today, the type of support that we are looking to give, in fact, that we've already given, was raised by the Prime Minister this morning. We have issued guidelines that were co-developed by provinces, territories, and the federal government. Provinces play a key role in helping our seniors. Another way that we can help is by sharing and distributing medical equipment. In Quebec and everywhere in Canada, it's important to have the necessary medical equipment, not just in hospitals, but also in seniors' homes. We are sending out this medical equipment at breakneck speed. And we're very happy to be able to help these essential workers, such as nurses and caregivers in long-term care facilities. We're very happy to be able to help these workers doing essential work in Quebec and elsewhere in Canada. Prime Minister Trudeau announced last Monday that we want to ensure that these workers have working conditions that are good. We want to be able to hire and keep people in these positions. Follow-up question. Are you considering financial support? Are you considering giving funding to help out these long-term care facilities? In so many of these facilities, they don't have enough staff, they don't have enough equipment. So will you follow in Quebec's footsteps? Will you help other provinces? You have mentioned, you've touched on some important things. First, Quebec has taken a step that is very, very positive, which is to increase the salaries of essential workers. And you've also raised the important point that needs are similar everywhere in Canada. The federal government is considering financial supports for provinces and territories so that they can continue to offer excellent services in long-term care facilities. Minister Freeland speaking. I'd like to add that we are constantly discussing this issue, not only with Quebec, but with other provinces. Thank you, and we will now take questions in the room.
Can I ask you about, I'd like to continue on the long-term care facilities. Who are our leaders on this issue? Like, do we have anyone who's getting it right and that we can learn from?
Well, thank you very much for the question. And first of all, I would just want to thank Minister Deb Schultz for her work in working with her counterparts and with our team to come out with the long-term care guidance documents that are now posted. And I will say that there are some people getting it right, and it's slow, but it's coming. And I will say that some of the work that British Columbia, for example, has done on the permanency of those positions and paying care workers enough so they don't have to work in multiple homes or multiple facilities is unlocking some of the answers around how we reduce the transmission of the illness. I think there's many, the guidance is quite broad, and I'm sure if you take a look at it, you'll see just the number of recommendations. But I do think that there is a value in having a larger conversation about long-term care homes and the way that we manage those homes in general. Coronavirus and COVID will be with us for some time, and given the epidemiology that we know about this virus, right, the disease pattern that we know now, we'll need to be protecting our seniors for a long time. And I think there's an argument to be made that this has been an area that's needed some attention for a long time as well.
All right, and you mentioned BC, and I was wondering if there's any other provinces that are taking strategies that we could send across the board that they're really latched on, that's working, that we could apply across the country.
Well, I'll turn to Dr. Tam. She may have more detailed information from the work that she's been doing on the special committee.
I would say that every province and territory are really seized with, doing best practices. So you've probably seen them publicly updating Canadians on what they're doing. That actually includes things like restriction of visitors, the new recommendation about wearing masks and for shifts, and also looking at improving how the facilities itself can screen health workers, visitors, and residents. So they're all trying very hard to do this, and they're exchanging their ideas across the board at the Special Advisory Committee. So I think just even in the last several days, you've seen many provinces trying to really strengthen what they're doing, because knowing the epidemiology itself.
Ian? Ian Wood, CTV News. You've told us that Canada has relied upon the WHO for intelligence on a global level, knowing what's happening abroad, for information and data regarding COVID-19. But was Canada assisted by any other sources of intelligence, either within our own intelligence community or our Five Eye partners, in developing or in knowing what was going on abroad? And if so, when did we first get an alert from this intelligence source that there was a pandemic issue?
Yeah, so we actually scan global media and other open sources for information on a daily basis. We have a system in Canada called GFIN, the Global Public Health Intelligence Network, and we do that sort of from a public health perspective. And we were able to detect, as well as other public health intelligence sources, the actual unusual outbreak in Wuhan when we first were alerted right at the end of December, like the 31st of December and sort of January 1st and 2nd. And I had already communicated with the chief medical officers by the 2nd of January as soon as we thought, okay, well, this looks a bit unusual. That was before we even knew what virus caused this. So those kind of public health intelligence are very much sort of alive.
It's Dr. New here. I could also add to that we also have very good personal contacts with our counterparts across the world, and including the U.S. And for myself and personally, we had daily phone calls. I had daily phone calls with the head of infectious diseases at the CDC on the situation that's evolved even from the beginning of January. So there was a lot of sharing of information between public health officials across the world, including between ourselves and the CDC.
So my second question, I'll then direct towards the Deputy Prime Minister. Intelligence experts have suggested, as we've just talked about, that we had an over-reliance on open source data, what was being given, say, to the WHO that we received, monitoring media, that sort of thing. So with regard to the intelligence community, when did we get intelligence from China that there was something bigger, greater than what was being seen on open source data? And was our intelligence community primed to act on these sort of this sort of information they were receiving?
Well, as you've already heard, Ian, our public health officials were very seized of this issue from the beginning of January, and were very involved in conversations both in Canada and around the world about what this novel coronavirus was. When it comes to Canada's intelligence partners and intelligence sharing, we have, of course, talked about the coronavirus with our intelligence partners very energetically throughout this crisis. For reasons of confidentiality, I'm not going to go into the specifics, but there has been, in addition to the work done by the public health officials, there have been intelligence conversations around this, particularly with our closest allies.
Julie Van Dusen, CBC, for Theresa Tam or Patty Hajdu, and it's about Jason Kenney and what he said about he wants to jump on tests and vaccines, circumvent Health Canada if it takes too long. He doesn't want to get bogged down by the bureaucracy, and he took some swipes at you about your positions on borders and human-to-human transmission. What do you say about that? And maybe you'd like to jump into.
Well, thank you very much. And first of all, I'll just say that we are so grateful, as a Deputy Prime Minister has said, to have the leadership of Dr. Tam and Dr. New, and in fact the entire public health team, and Health Canada, in fact, working day and night to help us as a country manage the coronavirus, COVID-19, and our response to it. I will also say that I also have confidence in how hard Health Canada is working to look at every potential tool, every potential drug, every potential avenue to both treat and protect Canadians. But I will also say that it's important, and I think Canadians would want to know this, that we validate these things using science to make sure that they are effective, that they are not dangerous, and that they are used in appropriate ways with scientific guidance. And so we work, as I said, extremely diligently, as always, but even more so now during this time. And I just want to thank the public servants for how hard I know they are working to expedite approvals of tests, for example, or other kinds of equipment that we need.
But Theresa Tam, maybe you could just answer, do you think he's trying to undermine you?
Just so that I have had an incredible collaboration with the chief medical officers, including, of course, the chief medical officer in Alberta, and we work really well together, and all of us are trying very hard that Canada across the board is giving us our best response. And I do think that I know our Health Canada colleagues have authorized a lot of tools that Canadians can use, and you know, they sort of authorize 51 devices, 13 authorizations for test kits, 39 authorizations for non-in vitro diagnostic devices. The list goes on. But we do want to ensure safety and the actual effectiveness of these tools, and I think the health community understands that. And But certainly we encourage also that the use of medications, that they be used in the context of clinical trials as well, because that ensures the fastest way to actually get some results as to whether they're effective or not and whether they are safe. So I think that's really important.
That would be a third question, Julie. We're already a little short on time, so we'll do one question on the phone.
Can I just add one final sentence, if I may, or two sentences? So, Julie, I think when it comes to Canada's response to the novel coronavirus, I would highlight two real strengths that we have shown as a country. The first is across the country, we have shown that we are a country that does believe in the value of expertise and in the value of science. At the federal level, that has meant we have understood the importance of our public health officials, Dr. Tam and Dr. New, playing a central role. And in provinces across the country, the chief public health officers have been central to provincial responses. In municipalities across the country, chief public health officers have been central to municipal responses. I have observed as a former journalist that chief public health officers across the whole country have become this generation's rock stars, and that is entirely appropriate. The second strength of our national response, I think, has been very strong collaboration between the federal government and provincial governments. That's essential always, but it is particularly important when we face a shared health crisis, a crisis where provinces deliver frontline health care and where the federal government needs to play an essential role as well. Our approach is going to be to continue to build up and use those two core strengths of Canada's response.
Thank you, Deputy Prime Minister. We're already running short on time, so we'll take one last question on the phone before we turn back to the room for one last question. Operator?
Thank you. Merci. Our next question is from Raymond Fillon from TVA. La parole est à vous. Please go
Raymond
ahead.
Fillon,
Oui,
TVA,
bon midi.
question.
Les nouvelles règles de
Hello,
quarantaine
good
pour les
afternoon.
voyageurs,
The
je
new
voudrais juste avoir une
quarantine
précision pour les
rules
gens
for
qui devront
incoming
aller à
travelers.
l'hôtel.
I have
Est-ce
a
que ce
question
sera à
about
leurs
that. For
frais à
those who
eux ou aux
will
frais du
have to be
gouvernement
quarantined at a
fédéral?
hotel, will that be at their own expense or will the government be footing the bill?
C'est Dr. New ici.
Answer.
La réponse
Dr.
est simple,
New
c'est le gouvernement
speaking.
fédéral qui
The
paie
federal
les frais pour
government will be
l'accommodation. Si
paying
on met
accommodation
quelqu'un
costs
dans un de nos
if we have to quarantine someone in one of
selon la loi
our
sur la mise en quarantaine.
locations under the Quarantine Act, then the federal government will be paying the bill. Follow-up question. This question is for Minister Duclos or maybe Minister Haidu. I understand that no provinces have formally requested that the Canadian Armed Forces help out, but can the Medical Corps of the Canadian Armed Forces help workers in senior centres and senior residences that are really overwhelmed?
Nous avons un portal pour
Patty Haidu,
les
answer.
personnes qui veulent volunteer pour aider les provinces
We
avec,
have an online portal
avec beaucoup de
on
choses,
which volunteers can offer their services to
les
help
personnes qui
provinces with a
travaillent
number of
les
things,
centres d'aînés.
including helping out in senior centres. Answer, Chrystia Freeland. The Medical Corps of the Canadian Armed Forces are today already participating in Canada's efforts to fight the coronavirus all over the country.
Tout à fait, M. Fillon, la réponse était très claire.
Jean-Yves
Les forces armées
Duclos,
disposent de
answer.
capacités d'intervention et d'appui
The
considérables.
Canadian Armed Forces have the ability to help out enormously, and they could be very helpful, especially in healthcare, if provinces should make a request. Question, Daniel Thibault, Radio-Canada. Question for Minister Duclos, maybe Minister Haidu. What is occurring was predictable.
Diriez-vous que ces
The
établissements-là étaient mal préparés
in
pour
long-term
faire face à
care
la crise?
facilities,
Et compte tenu du fait
we
qu'il y a
could have seen it
50% des
coming.
décès
And do you think these
rapportés qui se
facilities were
trouvent dans ces
underprepared or
établissements-là,
not
n'y aurait-il
prepared?
pas lieu de transférer peut-être une partie des
Moreover,
ressources du secteur hospitalier
should
directement
some
au foyer
hospital
pour personnes âgées?
resources have been transferred directly
Vous posez une
to
très bonne
long-term care
question.
facilities for
Comme
seniors?
c'est une question
Answer,
de
Jean-Yves Duclos.
logistique et
This is a great question that you're
d'information
asking.
plutôt
Your
provinciale et
question
territoriale. Je passerai peut-être la
is about
parole ou
provincial
bien
and
Madame
territorial
Haidu ou-
logistics, so
Peut-être je
perhaps
peux
Minister
répondre
Haidu would like to
anglais,
answer.
peut-être?
Absolument.
Minister
Parce
Haidu.
que c'est
Answer. I would like to answer in
difficile en
English
français pour moi.
Do you need me
because
to,
it's difficult for me to
repeat in
express
English, or
myself
you
in
okay?
French.
You got the translation?
I heard the question.
Okay, perfect.
I think your question is one, I think it's one that I answered earlier for another reporter, but I think I'll expand a bit because I think it's a really important question about the way that we value people who care for people. And I've talked about this a lot, and I'm going to step out on a limb and talk about it again today. And I was the Minister of Status of Women, as you know, when I was first appointed, and worked extensively on the gender wage gap. And you might ask, well, how does this even relate it? But it is actually related because, in fact, we tend to devalue the work of caring for people. And I think that this is an opportunity for Canada to think about how we value those who serve the most vulnerable in our societies, whether it is old people or whether it is children. And I used to wonder when I was the Minister of Status Women why it is that we valued more people who cared for vehicles than people who cared for people. And I think this is an opportunity for Canada to actually think a little bit more about how we will move forward with a stronger system of care for people who are aging. Because in fact, all of us in this room are going to end up there, and these are our mothers and our fathers and our grandparents and our aunts and uncles. And most of us have had an experience of visiting someone that we love in a long-term care home. And there are some that are run very, very well, and it is not universally terrible. But there are others that really struggle, and some of it is around the way that we pay people, and some of it is the way that we care for those facilities, and some of it is the way that we conceptualize aging. And that is a large project for Canada, but it's one that I'm excited about, actually, because I think that in every crisis there's a silver lining, and the silver lining for us is, I think, collectively with provinces and territories to think about how we will move forward from this time and really refocus our efforts to make sure that everybody has an opportunity to age in dignity with the care that they deserve at the end of their life.
Merci. En question supplémentaire, peut-être,
Follow-up
Madame
question.
Freeland, Où est-ce que vous en êtes avec les négociations aux États-Unis, avec
This is
les
a question
États-Unis
for
pour la
Minister
réouverture
Freeland.
de la
Can you
frontière aux voyages
tell
non
us what
essentiels et
stage your
quel genre
discussions are
d'échéancier
at with
vous
the
voyez
United
se
States about
dessiner dans votre tête
reopening
pour ça?
our shared border to non-essential travel?
Quand nous avons mis en
Answer,
place les
Minister
restrictions
Freeland.
à la frontière canado-américaine,
We
on a toujours dit que
put in
après
place
30
restrictions
jours, on
on
verra la
non-essential
situation.
travel at our shared border.
On a,
And we said at that time
on
that
travaille en
we
étroite
would
collaboration avec nos
reassess in
partenaires
30
américains.
days.
On parle
We work very
plusieurs
closely
fois
with
chaque
our
jour,
American partners.
avec nos
We
voisins.
talk to our American neighbors and
Le
counterparts
point de
several
vue
times
du
a day.
Canada est que c'est trop tôt
Here is Canada's
aujourd'hui
stance.
pour parler
We
du
feel that
lever
at this
des
point,
restrictions.
it is too
Comme le
early
Premier
to
ministre a dit ce
envision
matin,
lifting travel
nous pensons que
restrictions.
c'est le moment
As the
où
Prime
nous
Minister
devons
said this morning,
ajouter des outils pour être
we
certain
feel that it's
que les
important to
restrictions frontalières
add
qu'on a mises en
tools to
place
our
sont
toolbox to
vraiment
make sure that the border restrictions
Alors, ce n'est pas
be
le moment.
fully
Je
enforced
sais,
and
je suis
mandatory.
confiante
Now
que
is not the
il y
time
aura
to be
un
lifting
jour
restrictions.
quand on aura une frontière ouverte
I am
avec les
absolutely
États-Unis,
certain
avec tout le
that
monde.
our shared
Mais pour le
border
moment,
will be
c'est le
open
moment
again
quand
one
nous
day,
devons
open to
continuer de
all.
garder la santé des Américains,
But for now,
nos voisins américains,
we
et
must
aussi des Canadiens.
continue to prioritize the health
Merci, Madame
of
la
Canadians
Première
and
ministre. Ceci met fin à la
Americans.
conférence de presse.
Thank you, Deputy
Thank you.
Prime Minister. That concludes the press conference.